Hello, good evening. Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to my open clinic on weekend. Now, this evening we're going to look at gestational diabetes. Gestational diabetes. So we're going to look at what gestational diabetes is all about. Then we're going to look at management. If you happen to have gestational diabetes, how can we manage you to have a better outcome? This is the topic for this evening's deliberation. So please, when you join, let's know who you are and please also announce your location. So gestational diabetes is one of the medical conditions we actually worry about in pregnancy. So we have to take time to understand the likely presentation and what we need to do if we happen to have gestational diabetes. This particular topic will be very helpful to all pregnant women. Once you are pregnant, one of the mandatory tests we have to run when you go for your ANC, antenatal care visit, is to rule out the presence of diabetes. All pregnant women, once you are pregnant and you register for your ANC, we must conduct a test we call OGTT, oral glucose tolerance test. This test is going to tell us if you have a diagnosis of diabetes. It's going to tell us if it's the first time you are being diagnosed of diabetes, then we're going to manage you differently. Now, gestational diabetes simply means the diabetes we diagnose for the very first time during pregnancy. So gestation is simply the state of being pregnant. The whole duration of pregnancy is called gestational period. Now, like any other type of diabetes, gestational diabetes actually affects how your cells handle sugar, which is also called glucose. In gestational diabetes, your high blood sugar is the driving factor. So this high content of blood sugar can affect the pregnancy, can affect your health, can affect the health of the baby. Now, any pregnancy can have complications. This particular complication, this particular development in pregnancy is worrisome. Diabetes is a chronic condition. Thankfully, if your diabetes was diagnosed for the first time during pregnancy, it's expected that after pregnancy, your blood sugar level will come back to normal. Unfortunately, some women will continue to develop frank diabetes. Now, thankfully, if you have a diagnosis of gestational diabetes, we can actually control it through lifestyle modification, through positive behavior. So if you can eat the right kind of food, if you can stay active by exercising, and in some situations we can give you some drugs, if you can do these three things, you can control your blood sugar. When you control your blood sugar in pregnancy, you are helping your baby, you are helping yourself. It's important that your blood sugar is controlled properly, because if your blood sugar is not controlled properly, it will affect the outcome of the pregnancy. It will affect how your baby will present. It will affect the size of your baby. It will affect the lung functions of your baby. It will affect your health. So remember, a very good pregnancy will end with the baby healthy, the mother healthy, and the family also healthy. So if you have gestational diabetes during pregnancy, generally your blood sugar level needs to come back to normal after delivery. Now, if you've had gestational diabetes, the possibility that after your pregnancy you can develop type 2 diabetes is high. So one of the risk factors of developing type 2 diabetes, remember diabetes, we have two types. We have type 1, the type you can inherit from your parents, and type 2, the acquired form of diabetes. So women that have diabetes for the first time in pregnancy, if care is not taken, after pregnancy, some of them will go ahead and develop complete diabetes. Now, what are the symptoms of diabetes? Some women will have gestational diabetes and they will not have any signs, no noticeable sign. But generally, in diabetes, most people will present with increase for thirst. So you want to drink water frequently. Then as you're drinking the water, you also go to the restroom frequently. So polydipsia, the ability to gulp a lot of water, polyuria, increase in urination, and in some situation, polyphagia. You want to eat a lot, you want to pee a lot, and you want to drink a lot of water. Remember that in pregnancy, we don't encourage dehydration. So by default, you are expected to make sure you stay on good fluid. The recommended fluid in pregnancy is your water. Now, who can tell us what actually leads to diabetes? Unfortunately, as of today, we don't know the exact cause of diabetes. It's still unknown. So it's still a work in progress. Now, when do you need to see the doctor? If possible, if you notice, or when you go for your ANC, we notice that your oral glucose tolerance test is abnormal. The earlier you seek help, the better. So when you actually have the signs of pregnancy, connect with a good doctor who will run what we call prenatal care so we can keep an eye on you. It's generally advised that all women should go for their well woman check. So when you go for your well woman check every year, we'll keep an eye on your blood sugar, we keep an eye on your blood pressure so that we can start management immediately. Now, once you are pregnant, and we check for gestational diabetes, which is part of what all pregnancies must go through. If you develop gestational diabetes, then we give you more frequent visits. So all women that develop medical problems during pregnancy are placed as high risk. There are a couple of other things that will also make you to be high risk. Number one is your age. Once you are 35 years and above, you are considered high risk. So high risk means that pregnancy, we need to take extra care of that pregnancy. So we give you more frequent appointments. So if you likely have this in your past pregnancy, the possibility it will repeat itself subsequently is high. Now, like I mentioned, up to now, we don't know the exact cause of diabetes. However, based on a couple of researches, we felt that excessive body weight in pregnancy might play a role. Remember, there are a couple of hormones that work together to maintain your metabolism, and the major hormone that maintains your blood sugar is insulin. For some reason, when your hormones are not within the normal range, your insulin will not function properly, then you will have excessive blood in your sugar. Ordinarily, you're not supposed to have sugar in your blood. The sugar is supposed to go to the cells where they are used. Now, during pregnancy, for some reason, the hormones will change, making it harder for your body to control your blood sugar. When this happens, your blood sugar level will go up. So these are the classical presentation of diabetes in pregnancy. Now, it's your duty to acquire the knowledge of the likely way this will develop. Now, there are some risk factors. So risk factors are the things that when you have it as a woman in your pregnancy, you might likely develop gestational diabetes. Number one is your body weight. We don't want you to be overweight. That means your BMI should be hovering around the neighborhood of 18.5 to 24.9. This is where we want your BMI to be. Now, also, we don't want your BMI to be higher than 30. When your BMI is higher than 30, you are classified as having obesity. So obesity or overweight is a predisposing factor, a predisposing risk factor to developing gestational diabetes. Of course, we want you to be very active. So the fact you're pregnant doesn't mean you can exercise. So we still want you to move. The more you move and stay active, the more you're preventing the factors that might predispose you to developing gestational diabetes. Now, if you have had pre-diabetes, so pre-diabetes means your blood sugar is high, but we have not classified you as someone that is diabetic. That might also be an indicator of likelihood of developing gestational diabetes before pregnancy. So the bottom line is to make sure you do what you need to do so that when you become pregnant, you are not going to be predisposed to having gestational diabetes. If you have had gestational diabetes in your previous pregnancy, the possibility it will occur again is very high. If you have polycystic ovarian syndrome, the possibility that together with your polycystic ovarian syndrome, you might also have gestational diabetes is very high. If your sister, your mother, or anybody in your familial line has diabetes, you are also at risk. If you have delivered a big baby in the past, a baby bigger than 9 pounds, which is 4.1 kilogram, you are also at risk of developing gestational diabetes. If you are from certain race and ethnicity, like Blacks, like Hispanics, American Indian, and Asian Indian, these are the races and the ethnic groups that will have a higher possibility of developing gestational diabetes. For some reasons, gestational diabetes is not all that common in Caucasians. Caucasians are white. Now, there are complications that might emanate from gestational diabetes. Now, gestational diabetes needs to be carefully managed so that your blood sugar can be carefully controlled. High blood sugar can cause a lot of problems for you and your baby, including the likelihood of having CS. So mothers that have gestational diabetes will likely deliver through CS because one of the complications of gestational diabetes is microsomia. So your baby by default is going to be big. And when your baby is too big, your vagina might not handle delivering your baby the normal way. So these are the kind of things you need to expect. So if you have gestational diabetes, your baby might be at risk of excessive birth weight. The blood sugar needs to be within the normal range so we can know what to do. Very large babies, bigger than 9 pounds or more, will likely not be delivered through the vagina. Likely you're going to deliver through CS. So majority of women that will have this gestational diabetes might likely deliver through CS. Majority of the babies are going to come early. High blood sugar will also increase the possibility of going into early labor and delivery before your due date. Now, it's recommended we keep an eye on you during the whole period of pregnancy. We keep a closer eye on you. Now, when the baby is born, majority of babies born to women with diabetes will have low blood sugar at birth. This condition is called hypoglycemia. This is because the baby was solely reliant on the excessive blood in the body of the woman. Then suddenly that blood is cut off. So the baby doesn't really have enough supply. So most babies that are born to women with gestational diabetes will present with what? Hypoglycemia. Hypoglycemia is the opposite of hyperglycemia, which is excessive blood sugar. So these babies will have low blood sugar, which can be deadly. We must diagnose this immediately and intervene. Some babies will also have problems with breathing. Some babies will also have seizures because when you have hypoglycemia, your body can have a lot of things that can lead to seizure or convulsions, which might not be good for the newborn baby. Now, what can we do generally in regards to prevention? Now, there are no guarantees you can prevent developing gestational diabetes. However, the more healthy your lifestyle before, during, and after delivery, it's very important. So you have to eat healthy foods. You have to strive to maintain very good source of what you put in your body. Watch your portion size. Stay active. Go for walk, ride, swim, whatever keeps you moving. I'm talking about women that are pregnant. The more you engage in this, the more you will be in a better position to keep an eye on your blood sugar so we can know when to intervene. Now, when you want to become pregnant, work on your body weight. Start your pregnancy weight at a healthy range. So make sure your BMI is not higher, make sure your BMI is not lower, and make sure, of course, you're not within the obesity range. Focus more on lasting changes, especially regarding your eating habit, your activity level. Don't gain more weight than recommended in your pregnancy. Gaining too much weight in your pregnancy too quickly might be a risk factor of developing gestational diabetes. Overall, make sure you have the best doctor in your location and seek help as soon as possible. Guys, the clinic is over. It's time for your questions. Please start asking your questions. If you have any questions, feel free to ask. I'll give you feedbacks. Immediately after this clinic, I'm going to have another clinic in Facebook. So if you're in our Facebook group, please join me for that particular clinic. But that's my presentation on this topic. So I'm going to sit back and take care of your questions. So if you have any questions, please feel free to ask. Ask your questions. Let's travel and tour. Your question is not clear. You asked, what's the actual weight? What do you mean by that? Please rephrase your question and ask appropriately. Your question is not straightforward, it's confusing. What weight are you talking about? Keep asking your questions. If you have any question regarding the gestational diabetes presentation, feel free and ask. Well, your body weight regarding okay or not okay is dependent on two things. Your actual body weight right now and your weight. So I want you to be conversant with your BMI. We actually use BMI to know if the weight you currently have is actually healthy. So your height is very important. Once you get your height in meters, check your body weight in kg. Calculate your BMI. How do you calculate your BMI? Your body weight on top in kg over your height, meter square. Let me give you an example. If your body weight is 10 kg, put your body weight on top. If your height is 6 meters, put your height below. So your BMI will be 10 kg over 6 times 6. The outcome will give you your BMI. Now, your BMI should be within the healthy range. The healthy range is 18.5 to 24.9. I don't want your BMI to be below 18.5. And of course, I don't want your BMI to be more than 25.9. So once you begin to go above 25.9, heading towards 30, that's a problem. You have overweight problem. Once you cross over to 30, you have obesity problem. When your BMI is lower than 18.5, that's underweight, which is also a problem. So we want it to be in the middle. So to know if your own number is good, learn how to calculate this. Remember to convert your body weight to kg, then your height to meters, then do the mathematics. Very simple maths. Plug your weight on top over your height in meter square, and you get your number. Okay? All right. It looks like we don't have much people in the clinic today. So thank you for coming. I appreciate you. The next clinic will be on Tuesday. So join me on Tuesday, 6:30 p.m. Eastern Time, US, and I will talk to you guys about another important topic. Until I see you, God bless you and enjoy your evening. Bye-bye for now.